So it means that we must respect the patients as much as we can, doing our best knowledge in every single thing. Can I go now? Is it okay? Okay. So thank you for the Vietnamese Association for such a kind invitation. And I am a professor linked to the University of Illinois in Chicago, in the United States, already 14 years there, and also to the Vienna, Austria school. And my presence here is possible because the sponsorship of NAFON Lentwing. So thank you very much, Mr. Zumpitz here, for your support for the Congress. The Congress need also the commercial and business part, because this is the only way we can keep affordable for everybody and keep everything running. So let's go for my presentation. This is my email, okay, if you want to somehow contact me. If you like something or don't like something, you can contact me. So I like some quotes. So early diagnosis is nice to have. It's a vital part of making universal health care possible. If I don't have good diagnosis, the system becomes more expensive. Not only in your office, but also in the social, care of the population. So the population, people search for a service no matter what. If your diagnosis is poor, the patient needs to come back and come back and come back, and this is very costly for the service. So it means that the better diagnosed, the better you can to do a quick and assertive diagnosis is the best. So not only for the quality of your treatment, but also for your business, it's super vital to have a good diagnosis. So diagnosis is not blaming, it's about understanding the underlying causes. So don't try to find excuses. This is what I usually listen, okay? We need to go deep into the cause and understand the cause. Diagnosis does not define you, it is merely a piece of the puzzle that makes you unique. So the best diagnosis you can do, the better and, let's say, dedicated and special you'll be in your community, because you're gonna be different, you're gonna be the best. Okay? The diagnosis is the best you can do in your practice. Techniques come after, okay? So diagnostics is not about fault, it's about finding answers to your questions. Okay, so basically those quotes are in medicine, it's not dental, okay, so but it works perfectly for us because we are medical doctors of the mouth, neck, shoulders, and the whole body as well. So diagnostics has nothing to do with static. So if you are static and stable like this picture, I can understand forest from the static way, but if I just look this picture, I would think, oh, Forrest was in a wheelchair, this was not so good, he didn't move so nice, poor him, something like that. Because this is absolutely static. So when I take a shot, when I take a picture, it's a moment. So if I look the patient in the office and I take that moment as a starting point, this is really static. I need to go back, I need to forecast, I need to go super deep, and I need to understand the patient in motion, in life. Believe it or not, our patients are alive, so they are movable, they change every day. They adopt, they absorb the environment every day. So this is absolutely important to analyze them in movable, in dynamic. Now I can understand Forrest. Because now he can run, and I know this is a great runner and super good athlete. Okay? So this is what we need to understand And instrumentation in the diagnostic system is one part of our diagnosis that can really, really help to fully understand the function of our patients. And also reproduce what the patient has in the mouth or what the patient has in her system, okay, of recursion. So according to our professor from Vienna, Professor Rudolf Slavicek, he was tremendous prosthodontist. It represents a standardizing sequence of clinical and laboratory technical steps with the goal of recording and evaluating the static and dynamic relations of the teeth and TMJs. Okay? So this is really something to understand. And after that, we have to understand that things come from the joint and everything will somehow reflect on the joint in the TMJ. So understand the TMJ, understand the formation of the TMJ, and understand what happened to the TMJ at the moment is critical, okay, to develop a treatment plan. So otherwise, I will be always giving rounds and rounds and rounds in the treatment, and I will just do not focus the main cause, okay? So the TMJ is kind of warning area for us to absorb and understand the patient problem, okay? So basically, form and function in ontogenesis is like an independent sequence. So form and function in phylogenetic status, like the baby formation or kid formation, is the first trimester. Form and function in childhood from first 6 years during the milk dentition. Form and function during development of the permanent dentition is another stage. Form and function of the mature dentition is another stage. It means that even adult patients are transforming and adapting to the end of their life. Okay, so we are super adaptive, even if we are, very old. So what is the big difference before being a baby when we become adult? So what is that? So what is the sequence to fully understand the development of our stomatognatic system? So what happened during this, I'll say here, 40-something years, 50 years, okay, of transformation and adaptation? First, very important to understand that when we're born, we have no teeth. Okay, so as we have no teeth, nothing absolutely is ready. It's just the first time we came to the world, okay, we face outside, and we need to start to breathe, swallow, to have our functions ready to go. And basically our structures here are the skull, which contains the brain, and the brain is ready, okay, to keep us alive. Then we have the upper portion of the face, maxilla, okay, and the mandible, okay. So those three areas, and inside those mandible and maxilla bones, we have the germs of the teeth ready to start to born. When we born, we know that as we have no teeth, we born very short faces. We have a very, very lower facial height, very short. So because we have no teeth, then if we trace a kind of occlusal plane on a baby, this occlusal plane will cross the condyle. So it means that the ramus is super, super small, okay? And everybody born class 2. Nobody born class 3. Okay, so this is another very important thing to understand. To form the face, to develop the joint, we need the teeth. If we don't have the teeth, there's no really formation. So we need the power of eruction, we need the power of eruction of the teeth to have a very nice bones, beautiful bones, very well equilibrated upper and lower arches. So if we don't have teeth, everything collapses. So this system is very dependent on eruction. Okay? So if I make a connection between this maxilla mandible and the skull, this is super important to understand eruption. Look at the importance of the dentist when we see kids, because we can control and we can manage the occlusion on these kids and somehow guide and help a good and nice eruption. This way, the eruption of the teeth will help the bones formation in a nice way, okay? So basically, that's the sequence we will usually see. That we have no teeth, we born no teeth, and once the eruption of the teeth start to happen, especially the posterior teeth, the molar area and the deciduous, we will little by little increase the posterior vertical dimension, and this way, little by little, unload the joints. So we will little by little unloading the joint, until you become fully rooted permanent in tissue, okay? So that's really the sequence, what happened to us. And all these things are absolutely dependable on the environment where the kid is or where the patient is. Okay, so the environment changes completely and dramatically. The eruption sequence of the eruption quantity and direction. So depending how is this eruption, and depending how the patient adapts to this eruption, the bones will adopt different positions. Okay, and the joint will suffer with this. But everything starts from good breastfeeding, good ingestion of food, nutrition, function, breathing, position of the tongue, muscles working. This is a very functional input. And in kids from 0 to 6 years old, this is so dramatic. So the kids have to learn a lot from 0 to 6. So it's let's say the period of our time that we really learn the most. Okay? So we need to learn how to breathe, how to swallow, how to scream, afterwards how to eat, how to chew. First is liquid, after is solid. After that, we need to learn how to crawl, how to stand, how to walk, develop our equilibrium system. We still to have to learn a lot from the family. There's many yes and no's from the father and the mother. I need to learn the language. I need to speak. I need to communicate. Okay? And I need later on to start to read and transform all the knowledge I have in reading into words. This is a dramatic period of time, just in 6 years, to have this bunch of information. Certainly nowadays the kids are very stressed, as we see. So we have to pay attention sometimes that to make the system in equilibrium, I need both sides working very nice. Okay? So this is the first period of the time. The second period, when I have the teeth, when I have the milky teeth start to erupt. When the incisors erupt, I start to have interference in the system. Okay? And the mandible try to find a good position. And the babies become super nervous, very uncomfortable. This is painful, in fact, because touching incisors is a painful thing. Okay? So they become super uncomfortable. Luckily, suddenly the molars will start to come later on. Okay, it will happen that there's no only incisors contact. But in this first trimester, we need to learn how to stand. This is very important for the body formation, for the stability of the baby. And the baby always try to control the central nervous system and the cranial system to adapt. And when you try to erupt, we change the mandible position in the space. Once we stand, we are definitely changing as well the head rotation in the space. And when we change the head rotation and we upright the head, certainly we have a new position of the joint, a new position of the temporal bone, new position of the mandible in the space. So rotation of the head, change the temporal bone in the space with the T of the TMJ, and the mandible position will be also adapted in a new position, plus the teeth. Okay? So basically, the key sequence of functional development is like human locomotion, uprighting, posture, change milking to chewing, mother language learning, development deepening of self-consciousness, social integration. This period of time the kids bite the others is normal, with the psychic restriction, defensive aggression, so the kids try to bite each other. This is natural, let's say, mouth period of the time. And later on, when we have molars, the deciduous molars, the full dentition is ready. Okay, so it's around between 3 and 4 years of age. This time I have formed a surface of occlusion. So what happened at this moment is that the patient will start to define the vertical dimensions, even posterior and anterior. So now the mandible is not free anymore. The mandible has some limitations. Now the mandible needs to stop. And at the moment, the mandible start to develop the TMJ. Okay, the condyle start also to form and carve the joint. So a mature milk dentition in this age, bruxism is normal now. So it's a common problem in our kids. Bruxism is physiological, but I mean severe bruxism is a problem. And now abrasion of the teeth helps to support protrusive mandible in case where the mandible cannot adapt anteriorly by itself. Okay, so if I would say from the milk dentition to adulthood, I would have something interesting here to show to you. When we're born, we have no eminence, zero. Okay, so we're born no eminence, totally zero eminence. When we have full milk dentition, because now the function is closed, so the mandible is not free anymore, the eminence start to carve, the eminence start to grow, they start to form. And when we have a full permanent dentition, now we have a full formation of the eminence. So look at how the inclination of the eminence change with the occlusion formation, okay, with this sequence of time from zero teeth, deciduous teeth, and full permanent. So little by little, the inclination of the joint become more steep and steep and steep and steep. Okay? So the movement of the mandible in protrusion, opening, close, and sideways, lateral protrusion, change dramatically depending the dentition we are at the moment. Okay? And this is totally dependent again with the environment. Okay? So it's very important to understand that the moment we have the full dentition, it's also the moment that the kids is in the most important period of time of learning, and this is really stressful for the kids, and they usually use the masticatory organ to drugs and to release the stress. Okay? So in this period is the